Hello everyone. Today I am going to talk about the special palliative care treatment for different kind of diseases and stroke. Today we will discuss on the stroke. Well, you know what is stroke? Some kind of paralysis takes place. There is a brain hemorrhage is there, and the patient gets paralyzed. So first we will discuss about the stroke, and then we will discuss about the palliative care. So the major cause of ischemic stroke is arterial atherosclerosis. What is atherosclerosis? The blockage in the artery does not allow blood to flow to the brain, that causes the atherosclerosis. Other cause of a stroke is genetic etiology. About 15% of the stroke are observed in people aged 18 years to 49 years old. Monogenic and polygenic disorders represent about 7% and 38% respectively of all the stroke. So hemiplegia, what is hemiplegia? Hemiplegia is a partial or total paralysis on one side of the body. Hemiplegia and paraplegia, there are two terms which are very commonly used. Hemiplegia means one side paralysis, paraplegia means both side paralysis. It happens when blood flow to one side of the brain is limited or restricted due to injury or due to injury to the brain or spinal cord, due to stroke, traumatic brain injury, tumor or infection. These are the causes which can induce stop blood flow to the brain and which can cause the hemiplegia or paralysis. So hemiplegia, not a progressive disease but difficult to cure. It is sometimes temporary, though it is usually lifelong. Effect which has taken place that continues for the long time of their life. Physical and occupational therapy can help such people live active and independent life. Okay, this is a permanent damage has taken place in your brain, but occupational therapy and physical therapy can improve the quality of life. So remember, according to American Heart Association, AHA, high blood pressure is the #1 risk factor for stroke. That's why we say the hypertension is the silent killer. You should control your blood pressure as precise as you can, because any spike in the blood pressure can cause a blood leakage in your brain, and that can damage your brain and activity. So accounting more than half of the stroke cases are because of the high blood pressure spike. Now, over 80% of the stroke cases can be prevented if BP is strictly controlled. That's why the physicians, cardiologists always say control your blood pressure. So this is the picture I want to show: ischemic stroke versus hemorrhagic stroke. Ischemic, which is lack of blood flow, depriving brain tissue of needed fuel and oxygen. Fuel and oxygen deprivation in the brain because of ischemia is the cause of the stroke. Hemorrhage, which is the release of the blood into the brain. The blood vessel bursts out and the blood flows and it stops the in the tissue, blood into the brain and into the extravascular space within the cranium. It creates an undue, which suppose the blood has been collected here, undue pressure on the brain, which is makes it non-functional. This is the atheroma, atherosclerosis. In the artery, the blood clot blocks blood flow to part of the brain. This is a blood clot, and this is the leakage of the blood. There are two kinds of things. What happens? Impaired perfusion more than 3 minutes decreases in ATP. ATP is the energy coin. Mitochondria, loss of incoming oxygen. Loss of incoming oxygen. Because blood has been stopped, so oxygen has been stopped, so ATP formation has been stopped. And anaerobic glycolysis has started. This creates release of oxygen-free radicals. Free radicals are generated, which is not good for any tissue. And the brain is full of the lipid tissue. So lipid is getting oxidized by the free radicals and it is becoming non-functional. and accumulation of the lactic acid, because anaerobic glycolysis produces acid. So acidosis is created in your brain. Two bad things: free radical generation and acidosis. And acidosis, what will have? It will cause inflammation in the brain. It will damage the blood-brain barrier. It will produce the edema. So all these things will happen that will ultimately lead to the stroke. This is the picture of this. These are the, again, a slide I have shown to make you understand. So elevation of the intracellular calcium and sodium, they are the main problem. You see, NMDA receptors are overactive and ion pumps are overactive. So sodium and calcium concentration in the neural cell increases. With this increase, elevation, this increase, there is a glutamate release which leads to excitotoxicity. And activation of calcium dependent enzyme leads to injury of the cell membrane. And activation of the NO synthase that also leads to the cell membrane damage. What happens here? This has increased, calcium has gone high, free radical formation has gone high, and this has damaged the mitochondrial failure, and this has damaged the lysosomal release. Lysosome, I told you, they are for autophagy, and ATP, mitochondria, is for energy production. So both organelles are very important, and both functions are compromised because of the high sodium and calcium in the brain. And this is because of the low ATP, and low ATP is because of the low oxygen. Low oxygen is because of the either blockage in the artery or release of the blood into the out of the vessel into the brain tissue. So this is the link. I have given you the whole story, why ischemia takes place and why stroke takes place. So occlusion of the cerebral arteries, glucose down, oxygen down, ATP down, potassium up. This is the ischemia. So this is the figure, the same thing I have demonstrated here. So as I told you, blood pressure is the #1 killer, silent killer. It is a more risk factor for a stroke. You must know about the blood pressure. What is the normal level? Less than systolic. There are two measures in the blood pressure: systolic and diastolic. We always say 80 by 120. We are 120 by 80. So the higher one is called systolic. When the heart contracts, then the pressure goes high. When it relaxes, then pressure comes down. So contraction is called systolic blood pressure, upper number. Diastolic is the lower number. When 120 and 80, this is the normal level. 120 less than 80, elevated. 120 to 129, elevated. High blood pressure in 130 to 139. High blood pressure, hypertension is stage 2, this is stage 1. Stage 2 means 140 or higher. And hypertension crisis higher than 180. If systolic blood pressure is in this range, it is very serious case. You should control it, right? And diastolic higher than 120 is a hypertension crisis. Higher 90, 80 is the normal, remember. Higher than 90 is a hypertension stage 2. 80 to 89 is high blood pressure stage 1. And less than 80 is normal, less than 80 is. So this is the condition why I told you, because as a palliative care giver, you should know what is the normal blood pressure of the patient. And if it is going higher, you should immediately consult the doctor. And this is picture I am showing you, type of the paralysis, Monoplasia, one leg has been paralyzed, okay. Hemiplegia, leg and hand both have been paralyzed. Diplegia, both hands are paralyzed. Paraplegia, lower part of the body, both legs are paralyzed. And quadriplegia, the whole body has been paralyzed. So paralysis, paraplegia is a physical disability affecting lower body, causing paralysis from the pelvis downward, paraplegia. And common causes of paraplegia is spinal cord injury due to motor vehicle accident, gunshot or stabbing wound, fall, especially in individuals with weakened bones due to conditions like osteoporosis and osteopenia. So this is since I have told you in the beginning, this is because of the fall or the gunshot or anything. If it is affecting your spinal cord, then different kind of paralysis will take. If this part is damaged, here is the paralysis. If this part is damaged, here is the paralysis, like this. Depending on the where the trauma has occurred in your spinal cord, that will happen. And here the ischemic means blockage by blood clot, means hemorrhage by leakage of the blood. This is also the blood clot, transient ischemic attack. So these are the picture which I want to show you how stroke takes place in the brain. So now stroke and its palliative care. This is the point which you should know. Stroke patients with disabilities need rehabilitation to improve their physical functioning, mental status and quality of life. You have to assure these things. Aquatic therapy has been proved to be very effective in this. Research has been done in 2020 and they have found the aquatic therapy is an enrichment environment at the seaside threshold could play a role as tested on the objective parameters. These are the parameters they have tested and they have found that the intervention and the aquatic therapy was defined as the thalassotherapy regimen including aquatic therapy in seawater pool at 32 to 34 degrees centigrade for 45 minutes daily, 5 times a week. 5 times a week can improve. So these kind of patients can be of can get great help if they go for hydrotherapy or aquatic therapy. The stroke is classified under cardiovascular disease. It is a CVD because vascular cause, blockage or rupture of the blood vessel supplying to the brain. Shared risk factors, high blood pressure, diabetes, cholesterol and smoking. They are the shared risk factors. Common mechanism, atherosclerosis, clot formation and poor blood flow. Hypertension linked, most important, modifiable risk factor for the stroke. Overlap in treatment and prevention. BP control, statins and antiplatelets are the line of treatment. And WHO and American Heart Association classification, stroke includes in global CVD registry. This stroke has been classified as a cardiovascular disease. Now, unique practical palliative care steps for stroke patients. Positioning and comfort, swallowing support, communication aid, toileting support, pain and spasticity management, psychological support, family empowerment, oral hygiene, continence care, spiritual care, advanced care planning, sensory stimulation, social integration, and routine creation. So these are the domains where palliative care giver can give his services. So palliative practical tips, pressure relevance, cushion and air mattresses, texture modifier diet, thickened liquid and feeding position, picture boards, writing tablets, scheduling toileting, use of urinals and commode, massage, warm compress, oral and patch analgesics, physiotherapy, listening sessions, presence of therapy, guided imagery, transfer techniques, use of assistive device, emotional coping, moist mouth swabs, herbal mouth rinses, gentle brushing, bladder training, absorbent pads, assessing the religious symbols, rituals, or visit by spiritual leaders, elderly discussions on DNR, feeding tubes, ICU care preferences, aromatherapy, music therapy, familiar voice recording, structured phone video call, daily personalized schedule with meaningful activities. So these are the activities as a palliative caregiver you can plan for the patient to address these domains. So this is the take-home message for you. So this is the palliative care model I am showing you. So what is the goal? Treat the whole person. Your goal is treat the whole person. Promote quality of life. Support the family. Is an extra layer of support for all. This is your 4 goals which you have to fulfill, and the team Patient is in the center, family is around it, and then who are the people? Pharmacists, nutritionists, physicians, chaplains, I mean, spiritual gurus, social workers, technicians, HC workers, nurse aid, nurses, and therapists and psychologists. These are the people who are in your team, and as a patient caregiver, you have to connect the patient and his family with one of these who are required to give this four objective of your patient and his family. So this is a tree. It is a care for patient with life-threatening illness and their families. It can be given in home, health centers, hospitals, and hospice. Palliative care. I am talking about palliative care. It improves the quality of life. It benefits health systems by reducing unnecessary hospitalization. It relieves physical, psychological, and spiritual suffering. And lastly, it can be done by many types of health professionals and volunteers. It is not necessary that a medical graduate or a health professional should do palliative care. Anybody can do if he is volunteer and professionally trained. In this course which you are doing, you belong to this group. So if you get the successful trained in the 12-week course, you can give palliative care to, and you can fulfill these goals of the patients. So possible care need for stroke recovery, nursing care, physical therapy, speech therapy, occupational therapy, cognitive therapy, behavioral therapy, and home therapy. So these are the 7 therapies which can be planned for a patient of stroke. Okay, and 5 pillars of palliative care in Parkinson's or this stroke: assess and manage non-movement symptoms, support emotional and spiritual need, support care partners, advance care planning, and refer to palliative care specialists and hospice when ready. These are the conditions which you can apply to the patient who is suffering from a stroke. This is a very pathetic condition of that patient, and very attentive care is required, and you are the person who can do the best. Thank you very much.